Primary survey. What is a primary survey? So the primary survey is a quick way to find out how to treat any life-threatening condition a casualty may have in order of priority. So we can use the Dr. ABC to do this: the danger, response, airway, breathing, and circulation. What to do in a primary survey? First is check the danger. So NBLS, diba? Before approaching the casualty, always make sure the area is safe. So they taught us that always check first the scene before approaching the clients, because once the scene is not safe, then you can leave, because our life is more important. So daghan patag possible nga matabangan. So kumbaga your security is a priority. Next is the response. Check if the casualty is responsive or unresponsive. So as you approach them, introduce yourself and ask them questions to see if you can get any response. So in checking the response, kneel next to their chest and tap their shoulder and katunang, hey, 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 are you okay? Or asking what happened kung conscious iya. So if the casualty open their eyes or gives any gesture, so it means that they are responsive. So if they do not respond to you in any way, they are unresponsive and should be treated as quickly as possible. Next is the airway. So you need to check that the airway is open and clear. Open the airway by placing one hand on the forehead to tilt the head back, and use two fingers from the other hand to lift the chin. Since we are all familiar to the head, tail, chin, lift, and jaw thrust method, so where the purpose of these methods is to open and maintain a patent airway or to relieve a partial or total airway obstruction. So head, tilt, chin, lift is the primary maneuver in giving airway, and it is used in most cases unless head or neck injury is suspected in the client. So jaw thrust maneuver, in the other hand, is reserved for patients who present with head or neck injury. So if they are responsive, you need to move on to the breathing as quickly as possible. Next is checking for the breathing. So you need to check if the casualty is breathing normally. So place your ear. I mean, it is more applicable daw ingon ni Sir 2022 Sir P. Kasi possible mabait niya daw yung tenga if you're placing your ear in the mouth of the patient. So all you need to do is if you have mirror, so pwede naman i-flip kung naging siya breathing kayo, mag-moist man ang mirror, o kaya just observe, kasi naga-move din yung chest niya. So for checking this, you need to check for breathing and pulse is to place your two finger on the carotid artery to do this for 10 seconds. So butang mo yung two fingers in the carotid of the patient, then ipalpate mo kung naa ba siya pulse. So in breathing naman is to watch to see if their chest is really moving. So if they are unresponsive and no pulse and no breathing, so you need to call for 911 for emergency help. Kung naay tao sa palibot, then pwede rin ka manugo nga, hey, can you please call 911 and return to me. If ikaw naman isa siya, of course, before doing the CPR, ipula siyang no, if the patient or casualty is no pulse, no breathing, so you need to call first the 911 and then start the CPR straight away. If not responsible gihapon, so continue CPR. Then if are responsive and breathing, move on to circulation. Again, we all familiar with the stops, kung kailan tayo mag-stop in giving CPR, diba? Lastly is check for circulation. So once you have established they are breathing, look and check for any signs of severe bleeding. So if they are bleeding severely, you will need to control and treat the wounds and call also for 911 for emergency. And if they are unresponsive and still no breathing, if they are unresponsive and breathing but with no bleeding, so put them in the recovery position, just like what we do in CPR once nga naanag siya breathing and pulse. Once you have completed all this primary survey and have treated any life-threatening conditions such as bleeding, then you can move on to the secondary survey.